Hi everyone, my name is Nicklaus. I'm a third year philosophy psychology major, and I'll be presenting Confronting Cancer, exploring Latina women's experiences awaiting a breast biopsy. Breast cancer is the second most common cancer in women in the United States, and in 2022, estimates of about 209,000 diagnoses of breast cancer have occurred, and unfortunately, about 40,000 deaths occurred too. But something even crazier to think about is the fact that the number of mammograms and biopsies we have. Those being checks that you have to whether or not you do have breast cancer, and those would be these 1 month waiting periods of like very stressful situations. So if these are numbers for diagnosing deaths, imagine the number of mammograms and biopsies you have. Those being the millions, if not more, which would be some insane numbers to consider. Something we found during these mammograms and biopsies is that uncertainty while these diagnoses of waiting periods have happened are very hard, like the hardest parts they'd be experiencing. The anxiety levels increasing to clinical levels, which is something we do not want to see. Something we want to look for was Latino women often relying, or Latino women experiences along this, especially with family support and spirituality when coping with breast cancer. And this can be a helpful message we can use in the future to help people in these stressful experiences. Okay, it's downwards, not left, right. Anyways, so what we did was we used a dynamic analysis along 111 Spanish-speaking women in Riverside University hospital system for those who are waiting the breast biopsy. We had audio recorded interviews which can describe responding to 4 major prompts that are thematically analyzed. Those being what are their main emotions like what are they feeling, how was their what they're feeling, what was their main experience during that time, what are the hardest parts being what were their main hurdles, what are their biggest difficulties, what did they have to trouble experiencing, the thoughts, what kept them up at night, what kept going through their mind, what was running through, and their methods of coping. Major things like religion, other interventions, family. And we had this among 2 trained coders on a 90% agreement. Note this is also preliminary research. So the results we found were the fact along main emotions, hardest part, and persistent thoughts was worry. Worry is a major factor along all these 3 main categories. And when thinking about worry, we can't see that it's a major amount, but not all worry here is the same. Worry can be along multiple factors that we found in this data analysis, that being major things of, oh, I worry for how I'll be able to get to these biopsies. I worry about who will be able to pay. If I don't have insurance, how I'll be able to pay for these procedures. I worry about if my kids need to go to school and I need to go to biopsy, which one will I pick? I worry about when I get home, who'll be able to cook and clean in these situations. Worry is universal among these factors. However, worry is not all the same due to differentiations on how they will worry and what the main emphasis on worry is about. Also, along worry, uncertainty and fear was a major factor right behind these worries. Something interesting to consider, however, is along persistent thoughts that about 38% had no persistent thoughts, which is crazy to think about, especially since like, well, if you have a life-threatening disease, how do you have no persistent thoughts? So we wanted to look into the methods of coping. Those major things we found were distraction, faith, and family. Distraction being things like going on hikes, going out with friends to watch movies, knitting, different hobbies they have, things that will induce nice flow states to keep their minds off these stressful times. Another major factor we found was faith. Faith being a huge thing. Things like trust in God, trust in that things will be fine. Even like going to church or to have a nice social support system that they also find. Family also being a nice thing too. So if you have to drive your kid to school and also go to biopsy, maybe you can have an aunt, uncle, or friend, or some family member drive their kid to school, help you at home, essentially not so you have to run all this weight on you at the same time. So what was the main things we found? Well, less than 1 in 3 women explicitly mentioned worry about the biopsy itself. Family well-being and caretaking were major helps, this being that it creates some social support system for them to have. Because if your family is able to help you in these situations, as I mentioned before, you can have something to take the weight off you when needing to do multiple things at once. So again, if you need to go biopsy, you need to take care of kids, you have someone else help you, take care of the house, or if you need to go to work, things of such, or someone even to drive you to the hospital these times, but you have multiple times that just random that are now scheduled into your day and your Google calendar is looking like a mess. So also the fact of caretaking, many of these women also have children. So children being a mom, hard, difficult time. Going to biopsy that's stressful at the same time, can't imagine how difficult that would be. So you can also have some things to help you with these caretaking situations, which we could find that will help in your general health and longevity in this long term. Also, unfortunately, what we also found was that 1 in 5 women reported no effective way to cope with the biopsy experience. we cannot have this much numbers because that is an incredibly difficult time, and we should not be fine with this. If we just have experiences, which may cause long-term issues, because if they're going to a biopsy and they already do have the situation of cancer, they're going to have so many cortisol and other physiological issues that will be happening, along with psychological experience that may exacerbate these issues with worry, stress, and anxiety. So the question is then, what can we do to help the situation, especially among minority communities, Spanish-speaking communities, Latina women, in this? Well, we can try to look into a biopsychosocial model. Models or biofactors being things like chemotherapy, things that actually help if they do have cancer. Also psychosocial factors, psychological being anxiety, fears, and worries that can help not have these things be so difficult and exacerbate their possible cancer results. But also social model things that can help them with daycare, insurance, things help them get through these experiences that can have some sense of support in doing so. Results from the Spanish-speaking woman, that results from what we found was that support can help through family and faith. We can try to create faith-based interventions. That way, if they are worried about these situations, we can maybe offer them a church nearby that can help them, offer them examples of possible care that may help them. Major issues are factors also concerning that if your doctor only speaks English and you as your patient only speak Spanish, how are you going to interact with your doctor if you don't really have that also like immediate connection between the two, as well as differential cultural experiences that these two different people will face, and they need to interact to help the situation better. These are things we have to consider when looking into these medical systems and possible procedures. It's not just a fact of that whether or not you will have cancer or will not have cancer and then we'll be able to cure or help this cancer situation or not. There's a factor between that before that. Because if we don't look into how we can solve or fix the issues before that, we're going to have to continue to have these issues, exacerbating long-term issues like cancer and creating more issues that are already needed. And if we don't, we just fail the medical system and such. Thanks for coming. I'd like to acknowledge Brandon, Tran, Janine, and Medine, my mentors, for helping in this project so much. Sweeny, Dr. Sweeny, right here, Likeness Lab for getting the data in, Psychi for helping host our site, which is a major help, and Appropriate Psychology for helping. Also, the Riverside University Health System for giving us participants for this situation. I believe this will be the 5-minute Q&A section. Here's my email and LinkedIn if you have any questions that you cannot ask right now. Besides that, yeah, thanks so much.
So I just had a question on, so they were audio interviewed,
yes.
Correct? When were they interviewed? Like, was there like a designated time frame, like a couple of days after they got there? Like,
so from what I remember, I remember it was about maybe after or like 1 or 2 days after, so still like a close period of time in which the biopsy was happened. It was happening like way too long. I could totally see issues in it.
It was right before the biopsy.
Yeah.
The interviews after the biopsy. Yeah. They like went right from our interview into the procedure.
Yeah, sorry. So they happened right afterwards, which is helpful because if it happened too long afterwards, we have issues like them not having the same emotions. Oh, sorry. Hi, Vinny.
Okay. How do you think the way doctors communicate that diagnosis to patients affect their ability to cope?
Yeah, I think that's a major thing, especially since doctors, well, they do have some training in like helping their patients, but then doctors, of course, are not like trained psychologists or trained clinicians. They will need to probably like have some support in between that to talk to their patients who are going through, well, the fact that not all shoes fit every person. So tailoring each thing to different people and different experiences and different cultural values that can help them. So having your doctor get some training or possibly intermediate training with people between your doctor and your patient may help, and how your doctor can, tell what their future things are going to look like, what they're going to experience, what they're going to have to expect soon, maybe helpful things that may need a help. Your doctors can help your patients in between that. Oh, sorry, that's a question.
Since you just interviewed Latin women going through this, do you think it'd be different for women of different races?
Yeah, I think that'd be interesting, especially among Asian or African American communities, because the major thing would be like, I would see some Asian communities, I could think of be a collectivistic versus individualistic perspective on things of like different specific methods of coping that they'll need to worry about. And there might be there probably some interconnection between cultural experiences between Latino women and other groups, but it would be great to explore into different areas and see what those results will look like and similarities and differences we need to get.
So you interviewed the person who was getting the biopsy right, and like their experiences. Was there any like questions asked to their families? Cause like I know for me at least, if I have like a test coming up, I'm more on the calm side, but like if I tell my mom I have a test, she starts panicking.
Oh,
She's like,
yeah.
what are you saying?
That was actually really pretty
And
well,
so,
yeah.
like, did you ask any of like the family members to see if any of those their worries like just kind of seep through them?
Yeah, how it like
affected their-
affects a bigger thing, because not just the patient, it's also who the patients interact with and how they're like socially connected. I don't think we did that. Although it would be great to see how that would like spread further down the chain
Yeah.
on how that would be. I can imagine if I was like how my mother would feel at like a breast cancer
Yeah.
or cancer possibility of
And
such.
there's also like the thing with like different parenting styles.
Oh yeah.
So some might be more like,
Yeah,
oh,
close
this
to
is kind of
themselves.
your fault. Why didn't you eat properly or something? And blame it on
Yeah.
that, you know? So like there's just a bunch of different factors. I was just wondering if you like looked into any of them.
Yeah, we haven't, but that should be great to look into for a long-term future, especially those like long-term models of the fact that like it's not just like one person in the it's not when you're checking for like diseases, and it's not just the one person you're checking, but also how it affect their family, friends, and other people that they intersocial with coworkers and such.
We didn't interview anyone in the families, but we do have questions about this. It's not part of your project, but about how supported they felt in general in their lives, and they definitely were doing better if they said they had a lot of support versus very little support.
Oh.
Yeah, exactly what you said.
Okay, so I don't know if you tested for like family immigration status, but my question is like, what is the difference between a woman being a first generation immigrant and all of her family is somewhere elsewhere, and then other families, they might have parents and cousins and sisters
Like
who
with
might
the-
help these women cope because
Yeah, that'd be
they might reach out to them. So what might be the difference, and did you test for this?
no, I think maybe because it's too much for. I think it'll be definitely interesting on social connection and Sonia's lab on the facts of like about having a good social connection among their family members and friends might be a major thing, especially if they're physically there for you. If you are like first generation immigrant and a lot of your family are still back from like say Mexico, you may have to do phone calls that may be kind of like expensive and annoying to have, or just not having them physically there. Physical touch can be a major thing for the fact that they might be able to help you for your breast biopsy might be a thing. Not only is it physically there, but also like mentally there for factors as such. Like one physically thing like maybe they can drive you back and forth from the hospital, maybe they don't be able to hear your kids. A mental factor also like just feeling that they're there for you. Maybe make those phone calls if they can, possible time zone issues that they may experience too.